I am so excited to be here again. This is the third session I believe we've had. And I just really look forward to these because I love talking about pumping. It is probably my favorite topic, and one of my favorite areas to help moms with because I feel like there's just such a lack of support. And we were talking before this started about how there's just a lot of bad information out there that is very confusing and can just kind of derail a lot of breastfeeding and pumping journeys. And so I'm super excited to be here. But sure to chime in the chat, like if you have questions or you have anything that we really want this to be interactive. So I want to make sure that if you have a question, I answer it. If you have a comment or if you have an experience you want to share, that would be really awesome. To go ahead and share all of that. And so I see a few new names in here. I see some people that have been here before. And so I'm glad those that are here from previous sessions are coming back. Like we were talking about, it's this session is called Exclusive Pumping. I did change the name just slightly from what it says on the registration, but it's all the same content. It's just supporting families with skill and compassion because I think that those are two very important things. Having compassion to help these families in their pumping journeys because it can be very emotionally driven, as most breastfeeding journeys can be. But also with skill to help arm them with those resources to have success because a lot of moms end up exclusive pumping that did not realize they would. I just had a client recently who temporarily stopped nursing for her mental health to kind of get things back on track and started doing exclusive pumping. And she's transitioning back to nursing, but she did not expect to exclusively pump. And I hear that story over and over again. And so whether or not you are whoever you help, whoever the demographic of women is that you're helping, it's important to be able to help people with pumping because many end up exclusive pumping at some point, even if it's temporarily. Um, so my name is Katie Clark. Okay, so I'm a mom of four boys, ages ranging from 7 weeks to f almost 14, and they are wonderful. I am an international board certified lactation consultant. I specialize in helping moms find confidence in their breastfeeding journey, specifically with milk supply and pumping, which often kind of go hand in hand. My approach combines science-backed strategies with step-by-step support and clinical experience because we all know there's not always a ton of research out there on breastfeeding, and so some of it comes from just what I experience on a day-to-day basis. But the bottom line is always compassion. I think leading with compassion, it will help you help more families in the long run. I believe in being curious, asking questions, and always learning. I feel like I've learned a lot, and there's so much more that I can learn. And I think if we get to the point where we think I know it all, you probably haven't. So keep learning, keep experimenting, and I think that's important. And I am a paid presenter for Momcozy, but I have no other disclosures. Um, let's see. So I would love to hear in the chat, why do you think parents choose exclusive pumping? Like, I'm sure there's so many variety of reasons out there, but I'd love to hear what your clients say, or what you think is kind of like the driving reason behind exclusive pumping. And I know there's a lot of feelings on exclusive pumping, which we'll discuss that later. But pop that in the chat, and I would love to see that, especially what you're seeing with the clients that you work with. Um, why pumping support matters. This is just in general, but for exclusive pumping especially. Exclusive pumping parents often feel judged from all sides. They feel judged from the exclusive nursing side. They feel judged from the pumping, from the formula side, just everywhere. It's unseen in traditional breastfeeding spaces. It's become more and more common over the past decade or so, I would say. But, for a long time, low later league, it wasn't really something that they would talk about. I know like some organizations won't even let you be like a peer supporter if you exclusively pumped rather than exclusively nursed, which I think is really unfortunate. Um, and so it's just something that's more and more new. Let's see. So others can help feed the baby. Yep, I hear that a lot. Painful latch. Some want to breastfeed but struggle and then end up exclusively pumping so they can feed breast milk to their babies. I agree. The mom that I mentioned earlier, she told me, she's like, at the end of the day, the most important thing to me is that my baby gets my breast milk. And so pumping was allowing her to do that. Some want to bottle feed instead of nurse so they can but want to give their own milk. Predictability. Yep, I think these are all very common things that I see with exclusive pumping as well. Um, exclusive pumping parents often feel confused by crowdsourced advice. So if any of you get on Instagram, which I am very active on Instagram, so I try not to contribute to the confusion, but there's a lot of information out there. But there's a lot of crowdsourced advice, like on Reddit, Facebook groups, Instagram, especially for exclusive pumping. And these groups are very beneficial to help people feel support, but it often does leave people feeling confused. I have a lot of moms that come in and they're like, I joined this group and I was like so stressed out. And they're like, I bought all these millions of dollars, not millions of dollars, but tons of products that everyone said I had. And I'm like, okay, let's take a step back and come up with a plan that works for you. Um, but they're often overwhelmed by the physical and mental load because it's not just nursing from the breast with, not just nursing is quite a bit. But it's also not just preparing bottles, which also preparing bottles in and of itself can be a lot. Um, it's a combination of just about everything because you're pumping, you're stimulating the breast, you are trying to increase your milk supply, you are preparing bottles, you're storing bottles, you're doing everything. So it's a lot of, there's a very large mental load that comes with exclusive pumping. Um, so IBCLCs, let me minimize that there. By IBCLCs can completely change the trajectory for exclusive pumpers, but only if we truly understand their unique needs. And so if we go into exclusive pumping the way that you would with a mom that is latching at the breast, it's probably not going to be as beneficial. You can have some of those same, um, kind of the same basis, like the same um, approach, like with compassion and with education and like knowing the basics of milk supply and whatnot. But it's just a very different journey. And so it's important to know their needs. Just some recent clients that I've had from exclusive pumping. There was a mom who wanted to exclusively pump from the start. I mentioned her in one of my last presentations. And she had mixed responses from lots of people. And she actually ended up about a month or two in being like, I decided I kind of want to latch my baby. And we worked through that. But from the beginning, she was very much like, I don't want to. She had a lot of reasons for that. And so that was cool to be able to support her from pregnancy through when her baby was first born and helping her to increase her supply as we realized her thyroid was not working the way it should. And so it's cool when you can work with these moms from the beginning. I recently had a twin mom I was working with. The babies were premature and latching was too much for her. And pumping just offered more predictability, which one of you mentioned predictability was important. But the hospital advice was subpar. They gave her a list of people and they told her, oh, this lactation consultant works with twins. And she called that person up and she's like, no, I don't work with twins. And then the girl was a little bit like turned off to lactation care after that. But then we started working together when she was getting clogged ducts. And so she's exclusively pumping. And so that's been a neat experience too. There was a second time mom who's an overproducer, but she was relying on her wearable from the beginning. She was making a lot of milk, and then all of a sudden she was not making a lot of milk. And that's because she was using traditional advice for pumping for her wearable. And so we were able to overcome that because from different circumstances, the wearable was what was going to make it more possible for her to pump. Um, and finally, a mom with a traumatic C-section birth, latching wasn't happening, so she ended up exclusively pumping because it was better for her and her mental health. She had lower supply. When I first started working with her, she was around 10 ounces a day, and now and that was 3 months in, and now she's at about 22 to 23. But then she has had chronic clogged ducts. So just lots of different variables because clogged ducts are very tricky when it comes to exclusive pumping because a lot of times the advice is don't pump. And that's not really an option when you're exclusively pumping. So it's common comments that I hear, and I'd love for you to throw some in that you hear pumping families that you've heard be told to pumping families. Sometimes they will be given a lot of pressure to keep trying to latch, even if that's not what they want or not right for that situation. Often told pumping isn't breastfeeding. I know that's a very hotly debated topic, and I will admit I used to say, "Oh no, pumping isn't breastfeeding," which I feel I mad at myself for even saying that in the past because I believe it's all breastfeeding. Anything that has to do with breast milk, it's still breastfeeding because it comes from the breast. That their baby won't get backwash feedback, which is the idea of, their mouth on the breast, getting that, no, kind of having that back and forth, telling your body what to make with breast milk or what type of breast milk to make, the antibodies and whatnot. But we know now that that still happens just by being around your baby, kissing their cheeks, things like that. If you can pump, your baby should be able to nurse, which when people say that, it doesn't make sense because there's so many different factors involved. Pumping is too hard, just switch to formula. A lot of people will say that. They're like, what are you trying to prove? Like, if you're just doing this bottles, you might as well just use formula anyways, which again, many people want to provide that breast milk, even if it's not directly from the breast, like from nursing. Obviously, it's directly from the breast, but you know what I mean. And that wearables don't work for exclusive pumping, which I will say that's with an asterisk because you have to be careful with wearables, but they can be part of an exclusive pumping journey. Misconceptions within the pumping community is that you must pump every 2 hours forever. Some moms feel like they have to just pump all day, every day, and that usually does not lead to very good results. I have a mom I'm working with right now where she sent me her 24-hour pumping schedule, and it was just like so much pumping. And often I see when you're pumping too much, that leads to, poor outcomes as well. That you need to power pump daily, and that is not the case. Power pumping can be great in small amounts and for purposefully pumping and increasing supply, but it does not need to happen every day. That you have to pump at night and or that you can eliminate night stimulation early on. I hear both of those where you always will have to pump at night for the entire time that you're breastfeeding or pumping, or that you can eliminate night stimulation like right off the bat. And both of those can be harmful. That your output equals your supply. And there is some of that, but sometimes if your output's not where you think it should be, there's often something else going on. And so troubleshooting that. Oversupply is a big, I don't like to say issue because there's many moms that have oversupplies by no fault of their own. But there's a lot of push for oversupply in the exclusive pumping community. There's an influencer I was following who was like, I get mad when people say don't induce an oversupply. That's what you should be doing as an exclusive pumper. And I do not agree, because I can understand wanting to have that extra milk, and having that safety net, but at the same time, there's a lot of issues that come with oversupplies too. You can't use wearables if you exclusively pump. That's not true. This pump worked for me, so it will work for you. And I personally have experienced recently that that is not the case. I've tried ever since I had my baby, I've been trying all these different pumps, and the pumps that lots of people are like, oh, that pump's the worst or that pump's the best. I feel like it's been the opposite for me. And so finding a pump that works for the mom's situation and her goals and her body even makes a huge difference. This one might ruffle some feathers, but the pumping influencers are the ultimate source of knowledge. You see a lot of pumping influencers, and I think it's funny that we even have that term. And some of them are very skilled and they are, lactation professionals, but a lot of them are just sharing their personal experience, but which is fine, but making it seem like that is the gold standard for everyone. Or that only X model pump will maintain your supply. I know some people are very much like, you can only use the Spectra, you can only use like the Medela Symphony. And while yes, those are great pumps, there's a lot of different pumps that we can use in a pumping journey. And then this schedule or these settings is perfect for every mom. I think anything that is just cookie cutter and applied to everyone usually isn't the best approach. And you can use these to help guide, providing settings. So like if you look up Spectra settings online, you can use that to help a mom find the right settings for her. But just sending over settings being like, oh, these are the perfect settings usually doesn't work very well. Sometimes it does, but not always. Much of the advice found online is personal anecdotes, not evidence-based or generalizable. And so that's important to remember and tell your clients too, like, I never tell my clients, don't go on social media, don't go on Reddit, like, because I do think that there's value that comes from that. And there's a lot of support that comes from that, but helping them recognize maybe these people's advice, like take what feels right and then ignore the rest. So, this is not the slide that I meant to be in here. So we'll go on to this next one. So exclusive pumping moms need. What is it that they need? They need structure. They need predictability. They need to be comfortable while they're pumping. if someone's uncomfortable, that is very important because that can to solve that because that can lead to decreased supply. It can lead to ending pumping early because it's so miserable. So comfort is important. Emotional validation that what they're doing is okay. Like it should never like no one should ever feel like someone else has to tell them it's okay to pump, but sometimes it is our job to tell them it's okay to pump. Because sometimes they're not getting that from other people. Having clear expectations and realistic expectations, and knowing, like, I work with so many moms that I think in the past couple of weeks, I've had a couple people reach out for low supply consults, and they actually had an oversupply. But because they were looking online and seeing all these people pouring bottles of milk, they're like, oh, I'm not making enough milk. And so there's so much relief that comes from sharing what those clear expectations are for milk production. They need help choosing the right pump and settings guide. And so that's up to us to understand. We don't have to know about every single pump out there because honestly, there's only really a handful of pumps that are really great. So having a basic knowledge of those or knowing how to help a family figure out how to use their pump is important. But people will ask you, what pump should I use? And being able to listen to what their experience is important. I have a quiz that I send people that I'm like, take this. It'll tell you kind of which pump is going to be best for you, just kind of as a starting point. Guidance on sustainable schedules because it can be very difficult to have a good schedule with pumping, especially once you have other children. And then protection against burnout is important too. So why parents choose exclusive pumping and why it matters. I already mentioned this, and many of you chimed in with your thoughts, but there's many pathways to exclusive pumping. Sometimes it is merely choice. Someone wants to pump because it's just easier for a number of reasons, or they have some trauma that makes it difficult to want to nurse from the breast. Sometimes they just want other people to be involved and they just like it. Or they've had a previous child where breastfeeding did not go well. And they're like, I'm just starting with pumping from the beginning, so I feel like I have some control over the situation. Sometimes there's a medical necessity. The baby can't latch. Sometimes, if a baby has like a cleft palate or cleft lip, and they are not able to latch initially. There's or they have a heart condition. I worked with a mom who was exclusively pumping because her son had that heart condition, and so he couldn't be at the breast more than once a day. Um, Being in the NICU, pumping is very, very common in the NICU for obvious reasons. A lot of times these babies can't latch, they're maybe not gaining weight. Um, and I do see a lot of interesting advice coming up out of the NICU. There's a lot of great advice, there's a lot of great providers in there, but I think sometimes some things get lost in the shuffle and the pumping moms get put onto schedules or routines that may not be as helpful for when they go home. Latch trauma, so they are just have so much pain and they're like, I just don't want to nurse right now. Like the mom I was talking about, that she temporarily switched to exclusive pumping because her mental health was quickly declining because of the latching and how painful it was. Mental health, I think that goes into a lot of these things. It's just better for their mental health. And there's the opposite. I know for some people it's better to nurse than for to pump. And so that's always part of the conversation is like, I always ask moms, what is going to make things better for you? And that should be at the forefront of everything that we teach. Autonomy, they just don't want to have their baby latching, which is fine. I think it's okay to say that they don't want their baby to they don't want to be latching. So having a little bit more autonomy and be able to leave the house, maybe they're working a lot, they travel a lot for work. Sometimes those things factor in. Trauma-informed preferences just based on their past experience, or having past low supply and knowing that they would rather drive their milk supply with a pump than with their baby. Just like every nursing journey can have mixed feelings, because not everyone that nurses is like, this is so easy. Like most probably don't say that. They can have mixed feelings along the way. This is the same with pumping. Many pumping moms feel frustration and resentment because it felt like they were forced into pumping. And I see this a lot where people feel like they didn't have a choice, or they felt like it was just like that was what they had to do. And so that can be hard because with anything, if you feel forced into it without feeling like you had any like informed consent or you were a part of the decision-making process, it can make it just makes it miserable. And so that's important to kind of talk with families like, oh, let's talk about exclusive pumping and like what brought you to this point. Um, because sometimes there is a lot of resentment with it, and that can make it a more difficult experience. So the difference with exclusive pumping, with occasional pumping, there's a little bit more flexible timing. Sometimes often you're going to be doing it alongside nursing from the breast. And so you might do it after pumping or after you're nursing, or when you just are out and about and you need to leave a bottle with the baby. Work pumping is more structured and scheduled. It's partial removal of your milk supply. So, not during that pump session. You're obviously fully emptying your breast during the pump session, but your milk supply isn't totally reliant on removal with the pump. And nursing sessions are part of, obviously, the work pumping is often in supplementation to the nursing sessions. Then with exclusive pumping, all milk is being removed by the pump. So there's a lot more reliance on having a quality breast pump. With these other situations, sometimes we can get away with pumps that are not as great. But with exclusive pumping, your body is totally reliant on that pump. There's a higher demand on the pump efficiency. More sessions are involved and consistency is important. And then you're more susceptibility to dips and more frustration when that happens because you can see those bottles dropping. And, with nursing directly, you may have drops, but you may not always notice them as much because they kind of come ebb and flow. And that does happen with exclusive pumping. Like one day you'll pump a little bit more, sometimes less, like just based on those, day-to-day fluctuations. But it can feel more frustrating when you see that milk regularly dropping and going up and down. So, I don't know how to get that thing to go back up. What exclusive moms need most? I think I mentioned some of this earlier, but a primary pump, not just a wearable, but I do think wearables can be part of it, but a primary pump, so like your Spectra, I'm just looking on my shelf here. What are some other good ones? I personally have been loving like the Annabella. I've used that and had good results. Um, what is this one that's right here? Another popular one is like the Unimom, the Motif, like just kind of those bigger pumps. But you could also use ones like Baby Buddha and like all of those types of ones that are like not as big. Some people will say you should only ever like establish your supply with a Medela Symphony or the Spectra. I disagree. I think that you can use different pumps. A predictable schedule, coming up with something that is predictable and flexible, because it doesn't have to be like every single day at 9 o'clock you have to pump. Like there can be flexibility. The correct flange fit and type. You all know that if you've been on here before, you know this. Um, that the correct flange type, fit, and type is very important, and that is more than just, measuring and saying, "Oh, there's a number, like that's a good number for you, like go order these." Like there's so much more involved in that. Extra sets of pump parts, um, because that's one thing I do recommend investing in for exclusive pumpers are extra pumping parts. So you do not have to be constantly washing. There's obviously hacks out there like, oh, put them in the fridge or whatever. Not CDC approved, but people will do that. But having extra pump parts will make your life easier. A comfort focused plan and then mental health support and burnout prevention is really important. So establishing exclusive pumping, the first 48 hours, if someone is exclusively pumping from the start, we want to start stimulation early and, bring in that pumping. I've heard people that have exclusively pumped or that had to start pumping in the hospital be told, oh, you don't need to pump till you go home, which I'm like, when I hear that, it makes me just cringe because it's so not helpful. It's the same with a baby. If we want them to be nursing, we want to establish that early on. Generally, the advice is 8 to 10 sessions per 24 hours, but on the next slide, I'm going to talk about some of the evidence or lack of evidence for this. Teach hand expression, especially and pumping, because that can be helpful. I often include hand expression with a pumping plan, especially with colostrum. And hand pumps are awesome too for the first 48 hours, especially when that milk is so thick. I find some people respond better to hand expression or a hand pump. Begin with a primary pump. So generally, I don't recommend starting with a wearable, and focus on overall comfort with that. So frequency debates. Usually we'll say you should start pumping between 8 and 10 times a day, which is what we typically recommend for nursing as well. But there was something I read recently, which I found interesting. It was a review of studies, and this was specifically about NICU, establishing pumping, exclusive pumping in the NICU. And the review of the studies in regards to a mother's own milk being pumped 8 to 10 times was usually recommended, but most were only getting to about 3 to 5 times a day, which I think is reasonable. I'd be curious if any of you have seen that where, people are told to pump this much, but they really in reality are pumping a lot less. And this is from the source, specifically the article where it talked about closer observation of studies linking pumping frequency to achievement of lactation milestones, including secretory activation and coming to volume, which would be 500 mLs by day 14 is kind of the goal, has revealed that greater than 5 daily pumpings in the first 5 postpartum days is highly associated with achievements of secretory activation and coming to volume. Similarly, in a study in which all pumping behaviors were measured electronically, thus eliminating errors with maternal report, they found that greater than 5 daily pumpings compared to less than 4 daily pumpings was associated with greater pumped mom volume, excuse me, and achievements of SA and CTV. Um, so it was saying 5 is the baseline, not necessarily optimal, but if we can at least be like, let's try for 5, that's going to have a better result long term than if we're like, do 10 and then they do 2 or 3. And this was especially relevant in regards to NICU moms. And so, yes, we do have these averages, but there's not, you know, we have to be careful with being like, this is what you have to do, and more finding what's going to work for that family and helping them to optimize when they are able to pump. So once you start building supply, I do recommend 8 sessions minimum after that initial stage. And that can go down with time. A lot of exclusive pumpers pump 5 times a day, especially those that have a very large storage capacity. But I always like to say, let's start out with 8, kind of once they've gotten into their groove. Nighttime is really important still, that nighttime stimulation, that is when prolactin is highest. But we also want to protect the mom's health or mental health and sleep. And so we don't want them pumping like every 2 hours at night. Usually I say like 1 to 2, maybe, it just depends on the schedule that you're coming up with them. And also be able to tell these moms that you're working with that daytime consolidation is going to be possible later on. As we figure out what their supply is, what we see, what their storage capacity is, we can consolidate those pumping sessions. We just want to start out with more rather than less. Consider longer stimulation phases to get milk flowing more, pumping maybe a little longer than you normally would, and then we can always cut back later. Encourage hands-on massage and expression. I'm always really surprised by how many of the exclusive pumpers I work with have never been told, one, how to use the settings on their pump. Like they're like, oh, I was on the letdown mode the entire time. Or like I had a mom the other day who was only on level 2 with her wearable pump. And that's when she had an extreme drop in supply. And I was like, let's just go up to level 5. And her supply doubled at the next pumping session. And so helping with settings and helping them understand what those settings are, and then encouraging hands-on massage and expression, because I believe the research shows that like it can increase your output up to 50% when you are incorporating hands-on massage. And I find that this is very helpful for people that are struggling to empty, the breasts are never totally empty, but to fully drain their breasts during a pumping session. And then you want to help them evaluate pump type, make sure it's the right one when they can add in wearables as well. So signs of exclusive pumping is going well. Supply gradually increasing, peaking around 4 weeks. It should be pretty similar to if they were nursing at the breast. That just, it gradually does increase. Like the first few days, it does go up more quickly. And then by about 4 weeks, that's when we top out around 24 to 30. And that's sometimes we see people pumping way more, way less, especially if there's twins involved, they're going to be pumping more. Um, but a lot of exclusive pumping moms, I am like shocked by how much that they feel like they need to pump. Um, a lot think like double of like that 30. Like so I would say a lot of times I see people thinking that they need to produce 60 ounces a day for a singleton baby, which is not true. And so just having those expectations of what it looks like for them can be helpful. Steady diaper count, obviously, they feel somewhat stable. Obviously, they're going to be tired, but they shouldn't feel like totally stressed out and overwhelmed all the time because of exclusive pumping. No ongoing nipple pain because that can lead to so many issues, or chronic clogged ducts because we do know that pumps can cause an increased instance of clogged ducts. So being familiar with how to treat clogged ducts and the newest research on that is really important. There's a lot of providers that are still sharing the same advice that, really intense massage, heat, um, and like trying to get the baby to suck, like just like all these different things that like it's like a clog that needs to be sucked out rather than the inflammation that it is. And pumps can cause inflammation. And so it's important to know how to treat clogged ducts, and pump fit should feel comfortable. So common problems, top challenges that I see are low output from the pump, oversupply concerns with either having an oversupply and feeling like they have to pump all the time because of that, or feeling like they need an oversupply. Pain is a huge one. Burnout and resentment, very common. Nighttime pumping fatigue, inconsistent letdowns, or feeling like they can't totally drain their breast. The wearable pump limitations, overfeeding of bottles. I do see that often in exclusive pumping communities, and also just in bottle feeding in general, treating it like an unlimited resource and like, oh, if my baby will take 10 ounces, I might as well give them 10, like 10 ounces is a lot. But I do frequently see and I see exclusive pumping accounts talking about, oh yeah, you should give like 8-ounce bottles frequently. And so regardless of how you're feeding your baby, it's responsive feeding is important to teach to the families. Responsive paced feeding, where the baby's not getting tons and tons of extra milk. Pumping aversion, lack of provider support or education. A lot of people just can't find somebody like a lactation consultant that even knows how to teach pumping. And, I've had some conversations with colleagues who have told me like, that they've talked to people that are like, I just don't want to learn about pumping. Like, it's not something I'm interested in. And while I understand like focusing on things that you like specializing on things, I still feel like everyone should have a basic knowledge of pumping because that's really frustrating to go to a lactation consultant and be pumping and them not be able to help you. And then hospital support. Hospitals, they're a whole beast in and of themselves. There's a lot of red tape. There's a lot of things that take a long time to change. And even providers that want to help in the hospital sometimes can't because of things, their hands are tied. Like I know someone who works in a local hospital, and she said that she can't even like talk about smaller franchises because the hospital gets really upset about it. So it's hard with hospitals. Um, I've shared this troubleshooting framework before, but this is kind of what you can use to solve a lot of these problems, or figure out what to do next, is to identify the main symptom, identify what pump type they're using, what their current routine is, what their flange is, the settings that they're using, the environment that they're pumping in, and also what the emotional support that they have surrounding their situation. Because almost all of those problems can be troubleshooted by going through all of these different things. Not all of these things are going to solve all of those issues, but you'll at least be able to usually find the issue and what you can resolve from one of these things. So I always like to go through all of this, like, why is pumping hard right now? What pump are you using? Oh, okay, like how often are you pumping? Like, how long are you pumping? When are you pumping? Like, what flange are you using? Are you using inserts? Because inserts versus regular flanges are going to be totally different and can change the experience. I've seen people be like, oh, you're like a 15 in a pump flange, so just go get a 15 insert. And that doesn't always, or they'll be like, oh, you're using a 15 insert, so go get this flange. But there's so many different types of flanges that it's not like a one-to-one change. And there's so many different inserts too. And knowing like the settings and like helping them troubleshoot. So many of my consults, we've just changed the settings and it fixes everything. helping them to have a better frame of mind when they're pumping, making it a relaxing experience, which is not always possible, but trying to figure out how to make it less stressful for them so they're not just sitting there holding their bottles super tense and their arms up. We want to make it a good experience for them. And then the emotional support, seeing what what their partner thinks, like what their partner supports with it, what their work is like, what types of comments they're getting from family and friends. Like all those things are important to address. But I'll go into some of these more in depth. But fixing pumping pain, you want to identify what is causing the pain. Like I always say, where is that pain at? Is it in the nipple? Is it like deeper in the breast? Is it afterwards? Is it, randomly when you're not pumping? Do you have color changes? All of these things help you to fix what pumping pain, because not all pumping pain is the same. But you want to play with vacuum. Like sometimes when a mom maybe has nipple damage, like with one of the moms that was taking a break from nursing, she had nipple damage, but she needed to pump because it wasn't an option. Like she couldn't just not do anything. And so we just were like, okay, let's do the lowest possible setting for the shortest amount of time to get what you need. And so playing with that vacuum speed is important. Flanges, so much goes back to flanges. Lubrication can be really helpful. Not all moms need lubrication, but having like a pure coconut oil spray, there's some other ones that have more than a coconut oil, and I like those, but you have to be careful with allergies with recommending those. But lubrication can be really helpful, I find, especially for wearable pumps. A warm-up routine, so teaching them to like warm up their breast with lymphatic breast massage and very gentle movements. And then heat can be helpful as well. And then addressing existing damage. Sometimes a 24-hour hand expression break can be helpful if there's so much damage and they can't nurse, they can't pump. Um, that can be hard because not everyone can do hand expression. Not everyone feels comfortable with it, and so that can be tricky. But if someone is very feels really comfortable with hand expression, that can be helpful for addressing any existing pain that they have. Or a manual pump can sometimes be another good option because there's a little bit more, you're a little bit more in control. Slow letdown. Why does this happen? So this is when it just takes a long time to let down to the pump. Sometimes they'll have a hard time letting down to the pump the second time because usually we want them to have more than one letdown. But stress is such a huge part of breastfeeding, and that's something I've experienced again recently with my baby, where I'm like, I know when I am stressed it feels so much harder to pump or to nurse and to have that milk let down. So stress is hard and is a big part of slow letdowns. Pain, just because that interferes with oxytocin and it can make it more difficult to get the milk coming out. Wrong mode timing, wearables can be difficult to let down with. Aversion, if they just really have a very strong aversion to the pump, that can be hard. And then hormonal issues, especially thyroid. If someone has a thyroid condition, that can inhibit the letdown reflex and make it harder for that milk to release. Some things you can do to improve letdown response. And some of these things are a repeat from my last session. So if you're like, this sounds similar, it is similar. But some of it I was like, this is the same. I'm going to just put it back in. Extend the stimulation phase. Add warmth. I find warmth is really helpful. Compression and massage when they're trying to get a letdown. And that's not like really intense. It's like putting your breast up here and pushing gently and holding because we don't want to be like really like over and over. It's more press down and hold to help that milk flow. Rotate pumps so you can try a different pump and see which thing you respond to best. Teach relaxation and techniques. There's YouTube videos out there. There's like meditations you can use. Out of sight, out of mind. Sometimes that's where wearables can be helpful for some moms, where if they're not even like thinking about it, not looking at it, that can help with the letdown. Because a lot of times, if you're just staring at the pump, that's going to make it a lot harder to let down and to produce the milk you need. And then prioritize sleep and rest because it all comes back to that. Flange sizing and type. We want to make sure there's no rubbing, no blanching. You can have the nipple, it can touch the sides, and frequently that's fine as long as it's not like painful or it's not like super slow. Like it should be gliding evenly in and out of the flange. We don't want blanching isn't necessarily a problem if everything else looks good, but if I do see a lot of blanching, it makes me a little nervous and I like to try other flanges as well. ring marks, poor spray patterns. We should be seeing good, strong sprays of milk. Vasospasms can occur from the wrong flanges or the wrong settings, and many problems go back to the flange. This matters from day one. There was recently on LinkedIn a lady that was talking about how moms are just being overwhelmed by being told that they need to have the right flange, and they come in and they're like, I need the right flange. And I personally don't see this happening, but maybe it does. Um, I think that I see more people being like, I'm in so much pain from pumping, like this is terrible. But I do think it's important to teach flange sizing. Like if you're doing a prenatal consult, you don't need to do like a full flange sizing when they're pregnant. I probably wouldn't recommend that either. But you can measure, you can say, here's some inserts. Use those if you need them until we're able to see each other. Like it's not a huge deal, but we want to just make sure that you are getting those flange sizes, your flange sized correctly, because some people can pump with any size, while others will get significant damage really quickly. And you never know who it's going to be. Lots has changed with flange sizing. The standard of 24 millimeters is really not the standard. Most moms in my practice and what I've seen from other colleagues I've talked to are between 14 and 17. I'd love to see here if you do flange sizing, what the average size is in your community. But I rarely see over a 20. And most of the time it's between like 14 and 17. And it's not about just getting the smallest size possible. Sometimes there's a little bit of pushback. People are like, oh, you're just trying to get them in the smallest size possible. It's about finding a flange that fits the best with that woman's body. The Fits Guide is from Jeanette Frem. She has a great study. She has so many great resources. She's from Babies in Common, so definitely check out her research. And it's more than just measuring. Trying the different options is essential. Even when someone's like, "Oh, I was sized at the hospital," when I hear that, I'm just like, "Let's try. Are you open to trying?" And usually they are. I even have people who are like, "Oh, I'm comfortable," and then we try pumping with the right flange, and they're like, "Oh, actually, I was not comfortable. I didn't realize I wasn't comfortable." And for wearables, test the inserts on a traditional pump and then transfer those to the wearable. I find that to be the most effective way. Because most of the time you can't see what's going on in the pump unless you have like, let me see if I have my Momcozy. I don't think I do. I think it's in my kitchen. My Momcozy Air One, which is actually the wearable that I like the most. I've tried a bunch, and that's from different brands, and that's the one that I have really liked. But you can see the nipple in that one, but it is the only wearable that I know of that you can actually see what's going on. So trying the inserts with the traditional breast pump first is important. I would not recommend wearable or inserts for a regular flange. Always use like the hard plastic flange for that, but for wearable pumps, you have to use inserts. Different flange options, hard plastic. There's comes with the crater, the pano. There's the new saucer, which I just ordered some of those and I'm excited to try them out. And then a more traditional one that is what comes with the pump. There's silicone, which I don't love silicone, but there is occasionally a mom that will respond well to silicone flanges, especially when I'm finding that nothing else is working. Sometimes I will pull out pump and pals. Sometimes I'll pull out Lactec. And it just depends on the mom. And yeah, and then there's inserts, which I've already talked about. Those are not standardized. It's really like you can just go on Amazon and get like 20 different types of inserts. And I haven't found one that I love specifically. Um, but again, those are best for the wearables, not for a traditional breast pump. Low output, we want to discover what, or we want to talk about or figure out what the root cause is. So is there a pump issue? Is it a setting issue? Is it something with the routine causing the low output? Or is there a hormonal issue or like physical or anatomical reason that is causing that low supply? Um, and when it's a pump issue, it's often flanges, the type of pumps, the response to the pump. If it's a setting issue, we want to educate and adjust and help them figure out how to know what they're looking for when they're pumping. With their routine, change the timing, introduce heat, teach massage, make it more doable with their life. You can, kind of look at what they're pumping, see where you can add more gaps, or you can put things closer together. Sometimes I see moms where they feel like they have to pump every hour for 10 minutes or 20 minutes, and pumping that close together, I rarely see is helpful. Power pumping can be helpful like once a day sometimes. But if they're pumping all the time, because sometimes, we say, oh, the more milk you remove, the better, the faster the milk receptors, or the milk production, which is true. But sometimes when you're doing that so much, it introduces a lot of stress on your body and on your mind, and that can lead to lower supply. And then with hormonal issues, we want to help identify what's going on. We can't, obviously, within our scope of practice, unless you're like an NP, a doctor, anything like that, we can't like diagnose, but we can help to identify hormonal issues and signs of hormonal issues and refer for those for support with those because those do lead, you know, whether you're exclusively nursing or pumping, you can still have issues, hormonal issues that lead to lower milk supply. And I do see more exclusive pumping moms um, that are in the low supply community. So oversupply, this is often glamorized on social media and almost expected for exclusive pumpers. I mentioned this earlier. It can make you feel like you have it can, when you have if you want an oversupply, or that is your goal, it sometimes gives these moms a sense of control, feeling like, okay, I can't control anything else, but if I can control some of my milk supply and have lots of extra milk, it's going to make me feel better. This can sometimes lead to overfeeding, though. It can lead to clogged ducts, to mastitis, engorgement. Not always, but it can happen. There's problematic versus non-problematic oversupply. Problematic is, you know, if you're getting those clogged ducts and engorgement, or if you're nursing from the breast, obviously there's different issues that can come from the oversupply. Non-problematic is when you're just making a lot of milk and nobody's really affected by it. Like you're not feeling like I have to pump all the time. You're not in pain. You just make a lot of milk because some people do just make a lot of milk. And it's interesting when I have a first-time mom come in and she's like, I have just been making like tons and tons of milk. And she's like, I did not do anything. Like, I don't know why this is happening. And I do hope there's more research that will come out in regards to that. My theory is that it often has to do with inflammation, gut issues, and kind of some autoimmune conditions can often, I see that almost all without, I'd say 9 times out of 10 with chronic oversupply that just happened from the beginning, it's because there's something else going on in the body. You want to teach what's typical and support mom's goals and concerns. If someone wants an oversupply, it's important to like teach like, okay, these are kind of the pros and cons of that. But if that is what they want, I don't think it's our job to be like, no, don't do that. Like, because that's just going to lead them to not ask for help. And so educating is important, but still letting them be the one that decides is important too. But definitely educate on those downsides to the oversupply that sometimes happen. Pump challenges. Not all pumps are good pumps. Like I said earlier, I don't think there's just one pump you can use to exclusively pump. Um, but there's a lot of bad pumps. Like I could there yeah, you have to be careful because people will be like, "Oh, I got this pump from my sister-in-law that she used 10 years ago." If that's the case, we need to kind of gently be like, if you're exclusively pumping, we probably need something else. Using the wrong combination of pumps. A lot of moms that are pumping do have a variety of pumps. They have like a wearable, they have a traditional one or two sometimes, and then like a manual pump. Teaching the different times and purposes for those can be helpful. Flanges, and then incorrect settings, which we've already talked about. And then burnout, we want to help pumping moms, exclusive pumping moms, have a sustainable routine that they can rely on and that feels doable for them. Because anytime I provide recommendations on a schedule, I say, how do you feel about this? And also know that you can change this to adapt to whatever your life is like. Um, we want to eventually get to the point of the least amount of pumps needed. We don't want to start out with the least amount of pumps possible, but that's eventually the goal is to figure out for that mom's storage capacity how frequently she needs to pump. And that does take some trial and error. We see how much she's making, how much usually, and anytime we eliminate a pump session, we need to ask, what is the amount of milk that I am comfortable losing if I drop these pump sessions? Teaching coping and distraction strategies just to make it easier. And if you have any ideas or suggestions on these, I would love to hear them, like things that you teach or just that help to prevent burnout, because that's one of the biggest problems I see. We want to find ways to make pumping easier. I will always say some stimulation is better than none at all. And so that's where, if I'm like, if a wearable helps you get that stimulation in, then that's okay. Like, I'm not going to say you have to use your spectrum. Like, I'm working with a mom right now who told me, she's like, I can only commit to pumping once a day with my Spectra and the rest have to be with my wearable. And I'm like, that's okay. Like, it's important to know that that may not always provide the most amount of milk, but it's what's going to make it easier for her. And we want to make it as comfortable as possible because if you're in pain, that's going to lead to burnout. Pump aversion, just dread, panic, irritability, urge to quit, anxiety, demer. Um, a lot of these can be related to demer, the dysphoric milk ejection reflex, where that's where you kind of have those feelings of doom, dread right before your milk lets down, and then it gets a little bit better. Um, but these things can happen for so many reasons, and kind of helping discern what those reasons are, figuring out if there's anything you can do to make those better, and also referring for mental health support can be helpful. Um, Especially if there's a strong pump aversion, sometimes like a perinatal mental health professional can be really helpful for those situations. Um, Supporting that is validation, fixing the fit and comfort, reducing the sensory overload because some pumps are more overstimulating than others. Figuring out how to shorten sessions. Like with wearables, you have to pump much longer than say with some more traditional pumps. So if they're like, I just want to get this done as quickly as possible, then maybe a more traditional pump is going to be best for them. Grounding strategies, so like looking at things like being like, I see something, I feel something, I hear something. I know there's some acronym for that, but I can't remember what it is right now. But helping them to kind of stay in the moment is important and distracting from the pump. Using a different pump, there are different vibration patterns out there that some people respond to better. And then reframe pumping as a choice. Tell them that this is what they're choosing to do right now, but they can always change that. So the emotional side of exclusive pumping, sometimes some of the emotional realities are grief over nursing not going as planning and having to pump. Sometimes there can be resentment towards that pump. I know I experienced that with my second. I wasn't exclusively pumping, but I was having to pump a lot. And I remember sitting there pumping and just seeing my baby and being like, I hate this pump. And so going over kind of discussing that grief and helping them to like come to terms with things. And again, this is where some perinatal mental health support can come in handy. Um, there is grief that comes with that. Shame from breastfeeding spaces. That is something that many exclusive mom pumping moms, which is where I think a lot of these exclusive pumping communities online have been created and also become a little intense because so many of these moms feel a lot of shame from those other breastfeeding spaces. But again, there's stress that comes from those pumping groups as well because there's so much information, so many oversupplies, so many like this hack is going to work or this product you have to buy. There's a lot of stress that comes from that. Feeling unseen or feeling like your sacrifice or your experience isn't valid can be difficult. Pressure to hit certain ounces because when you see that milk coming out, there's a lot more mind games that come with that. And then the burnout. So your role as a lactation consultant is to validate the choice for the exclusive pumping mom. I think that that's important to help her feel supported, help her to feel that you know, this is a great option for her family and for her baby, and helping her to reframe that can be helpful. When wanted, we can provide education on pros and cons, but if someone has already chosen to exclusively pump, or sometimes they don't always choose it, it just is something they have to do, or having to for whatever reason, we don't need to convince them to try nursing. Like if they want to nurse, we can definitely bring that conversation up. But if someone's like, I'm exclusively pumping, we shouldn't say, well, don't you want to pump? Don't you want to nurse instead? That's not helpful. Normalize their feeding method and just say it's another variation of normal, and that's fine. Celebrate their persistence and their diligence with it. Provide realistic expectations for milk supply, what might look like over the course of 12 months. Tell them you may be pumping 8 times now, but 5 months down the line, 3 months down the line, it could be less. Like providing those realistic expectations is important, helping them protect their mental health, discourage obsessive output tracking. I think, so many moms are tracking every single ounce, and sometimes that can be helpful. It's helpful for me as a lactation consultant when we're trying to figure out supply issues. But if it's like obsessive and like tracking every last ounce, that can, lead to mental health issues and burnout. help them to find support groups and connections, and then advocacy work among other like that's something you can do with other lactation consultants. That's what this presentation's about, is helping to help others better the experiences for exclusive pumping, reaching out to providers, to hospitals, doing like being that squeaky wheel that gets people to be more supportive of exclusive pumping is important. So wearables, can wearables work for exclusive pumping? Yes, but with structure. Ideally, not for early postpartum when we are trying to establish supply, but sometimes they can be a part of it, especially depending on um, who it is. If someone's in the NICU and they have a hour-long drive, 30-minute drive even to the NICU from their home, sometimes having a wearable in that situation can be really helpful. They're excellent for convenience and making pumping actually happen because, like we talked about earlier, the amount of times people actually pump and versus what we recommend is often there's a big disconnect. So sometimes that can fill in the gaps. It can be challenging for certain body types. Those that are larger chested often do have a harder time with wearables because they feel like they're just adding even more bulk. It can be hard to make it fit correctly. And so helping people navigate that's important. I do believe that you need to pair with a primary pump, especially in the beginning. Some don't, but this is often the exception. And if they do want to just use their wearable, you really have to have those flange sizes and the pumps down, the flange size and the settings down right because it can really impact your supply. They're best for extra flex sessions, and you want to make sure that it's actually a good wearable pump. There's a lot of bad ones out there. Um, and I've talked about some in the past. The first presentation, which you can watch on YouTube, I go more into some of the ones from Momcozy. Um, I personally have tried quite a few of them, and like I said, I really like the Momcozy Air 1. It is one of their more expensive ones, though. But a lot of people like, there's a lot of different wearables out there. Um, some of the ways to make wearables work for exclusive pumping, lengthening this, and these can be applied to regular or to other pumping sessions as well, even if they're not exclusively pumping. You want to lengthen the sessions. Usually, I find you have to pump for about 10 minutes longer than you would with with a regular pump. Check the alignment carefully, which is hard because you can't see it. So if it doesn't feel right, teach them what they should be feeling. It shouldn't feel pinchy. It should feel just like a gentle tug. Um, they should use inserts when needed, use a pump spray. Um, I don't know why I wrote stings there. I was putting this together last night while we were watching a football game. So some of this is a little bit, um, it shouldn't sting. Maybe that's what I was trying to say. Rotate with a primary pump every 2 to 3 sessions and explain limitations kindly and neutrally. We don't want to be like, wearables are the worst ever. You should never use them. Like, why would you ever want to use one? I have heard people be told that, and I don't think that's helpful. But we want to explain those limitations because some people, I will talk to them and they're like, oh, I'm using my wearable all the time. And we don't want to be like, why would you do that? Which I don't think any of you would, but sometimes that happens. But just be kind about it. Be like, well, there are limitations with wearables. Let's talk about those and see how we can incorporate this. We want to help the mom feel actively involved in her care and her decisions. I did want to mention the V1 Pro. That is a wearable from Momcozy. And this is one that they have designed to be more for exclusive pumping, especially in the beginning. It does have tubes, so it's not completely tube free, but it does have their third generation motor. I have this one. I need to try it. I actually haven't tried it yet. But it is designed to be stronger and be more ideal for exclusive pumping. So avoiding burnout, sustainable scheduling principles, pump more when supply is being built, consolidate later, avoid sudden schedule changes. So like going from like 8 pump sessions down to 5 overnight, prioritizing sleep. That is a hill I will die on with everyone that's breastfeeding, whether it's nursing directly or pumping or a combination of both. Sleep is so important. Know how to drop sessions strategically. Usually I'll say, pump or put the sessions closer together, or maybe drop a little bit at one session and then start consolidating. We don't want to do it drastically because if the supply drops more than we want to be able to add that back in. And then understand storage capacity. Nancy Moorbacher has has a lot of information on like the magic number, and I would recommend looking that up if you aren't familiar with storage capacity. Guiding principles, comfort first, efficiency over intensity, flexibility with pumping routines, having realistic expectations. What advice do you give typically? I'll comment that. I'll respond to that in a little bit. Um, where are wearable and primary rotation, emotional validation, and separating reality from social media. So the Q&A, we'll go into that now. So there's already a question, and if you have any, please put them into the chat. Anything and everything, any comments, thoughts, whatever. I'd love to hear them. But what advice do you give to families when it comes to prioritizing sleep? It's tricky, but I will say try to get like two pump sessions at night and to have everything at your bedside. So having like a milk cooler so you don't have to go put milk in the freezer. So things like this. I think Momcozy has a milk cooler. I know they do because I have it in my kitchen right now. Um, but there's a lot of milk coolers out there, so having that um, available at bedtime, having their partner involved, that's a great time to involve a partner where they can help to get bottles ready to help to feed the baby while you pump. If they're available, that makes a big difference. But I will say, don't, I do talk about the importance of pumping in the middle of the night, especially in the beginning. But we also want to make sure that they're not pumping like every 2 hours at night. So I'll say like, let's get a good pumping session in at 3 a.m. Do one right before bed at like 11, 3, and then like if we can do like 6 or 7, 6, 7. My kids would be very proud of me for that. Um, but yeah, I would love to hear what some of you guys do to recommend because sleep is hard because sometimes we do have to balance like what is most important to them. Like, do they need a full 8 hours of sleep? Which some moms do, and they're like, I don't care. That is more important to me than everything else. Um, yeah, I know you have kids too. You get that. Um, but then other people are like, well, I just want as much milk as possible, and just I don't know. It's tricky. Um, but sometimes even during the day, having less pumping sessions, but that are more efficient, can help with that nighttime sleep as well. Um, let's see, any other questions or comments? I would love to hear any of them. I'll let you have a couple more seconds while I go on to just the key takeaways, which are exclusive pumping is real breastfeeding. It requires unique guidance, early routine plus correct pump equals success. Emotional support is clinical support, and wearables can play a role with intention. Yes, so the link, I think that Momcozy has that they will send out. I know that they are available somewhere on YouTube. I'm not sure where, but I'm sure that we can get those presentations. If you want to respond to like the email, um, you can do that, but I'll also reach out to my contact too to make sure you get those because we've done one. The last one was on troubleshooting pumping issues. The one before that was just about pumping in general. Um, so hopefully that will be helpful. Um, the last week's recording is lost in the cloud. Oh, okay. Well, hopefully we can find it. But maybe we'll be able to do these again. But I'm so grateful for everyone joining in here today. I hope that you've learned something. Um, yes, I just mentioned having more efficient and fewer pumpings during the day, and this helps with sleep. I just find that it's just that less of that emotional overload. I don't know what the right word to put it. Um, I feel like if you're just pumping all day long, that can get you kind of hyped up. It can make you feel like super stressed throughout the day, and it can make it more difficult to sleep at night. And so I just find that decreasing stress in general helps lead to better rest when you are able to sleep, if that makes sense. What are your favorite Momcozy pumps? Yes, there are so many out there and there's so many opinions on them. And this is more from my feedback from my clients. A lot of moms love the M5, or is it the M5? I think this is the M5. Um, there's the S series and there's the M series, and that's where I get mixed up. But this is the M5. A lot of moms really like this one, and I hear very consistent results and experience. It's been around for a while. Um, I just had a client come in who's like, I did research forever, and she's like, the M6 was by far the one that she felt was the best, and she had really good experience with it. I saw it in action. That's the one that I don't have. And so the M6 is a really solid one as well. Um, I personally like the Air one. There's it's a newer one, and so I don't know about the longevity of it yet, but I like it. There's a new one coming out called the Wellness one, which I'm excited about because it incorporates massage and heat, which I think is awesome. So it'll be interesting to see that one once it comes out. That's coming out, I think, like the 31st, maybe. It's in pre-sale right now. I'm trying to think of the other ones. There's like the S9 and the S12, which are more like, I don't have one of those right here, but it has like a box on the top. And those are less expensive, and some moms really do like those. Um, it just kind of depends on their needs and what they are looking for. Um, yeah, hopefully that's helpful. There's like the V1 Pro. I don't really see a lot of people talking about the V1 and the V1 Pro. Um, but I need to try those out. I'll probably try one of those out this week. And if you follow me on Instagram, maybe I'll share that there. But yeah, that's a great question. Of the Momcozy because they have so many and they're always coming out with more because they're always trying to make them better. Um, and that's one thing I do love working with Momcozy because I think that they genuinely want to make pumping better for families. Um, and so, yeah, those are great questions. I don't know if there's anything else, but if not, I will go ahead and exit out of this. And I am so grateful for everyone um, who participated today. And I hope you'll participate in the future and invite all of your friends that are in lactation because we want more and more people to participate.
Agreed, agreed. Thank you so much, Katie, and thank you for all of the great information. Thank you guys for joining today's session. We hope that you found the discussion helpful. This is just the third session in this professional education series, and we plan to host one every month moving forward. This is all very new. So as we continue to grow, the plan is to offer these sessions monthly and perhaps move into in-person sessions as well.
Mhm.
As Katie mentioned, if you know someone that may be interested in this content, please feel free to share the registration form with them. Tell a friend to tell a friend. The goal is to build a long-term collaborative series where we're able to join every month and just be here and just share advice and support each other and advance the field of lactation together. We will send out the I can't think today, a feedback form after this call. And we look forward to hearing your thoughts and suggestions for future topics. I know that there was a question about the last session last month. It got lost somewhere in the cloud. I think I've communicated with my HQ just to let them know that it didn't download the way it normally downloads with my other webinars. And they are currently troubleshooting that. So I will see if I'm able to get that out and I will drop my information here, MCP at momcozy.com. My voice is so hoarse. I'm sorry, y'all. But MCP at momcozy.com. And hopefully, when we do get those recordings, I can send them out directly to you. And it should also come from Momcozy. So, again, thank you, thank you, thank you. Hope everyone has an amazing new year. And we will see you again next time, next month in the new year.
Yes, thank you, everybody. I appreciate your comments and everything. So thank you.
Thank you.
Bye bye.
See you next time.